presenting today is Taylor Robinson. She is a rising senior at St. Louis University from North St. Louis County. She's pursuing a double major in public health and African American studies. Her research interests include critical race theory, health disparities, health and social inequities, and the intersection of race and health outcomes. At SLU, Taylor is involved with the Black Student Alliance and the Society for African American Studies. She has been named to the Dean's List for her college each semester, and outside of her studies, Taylor is an intern with a Red Circle and has volunteered with Big Brothers Big Sisters and Kingdom House. Take it away.
Thank you, Cedar, for the introduction. Hi, everyone, and thank you for being here. Today we're going to talk about police brutality and trauma. So the outline of what we'll talk about today. So first, I'll give my study rationale, kind of what I'm going to be talking about with you guys today. Some background information about trauma. I'll talk about my methods, my main points, and then we'll conclude. So this is the study rationale. So basically, policies like Jim Crow segregation and the war on drugs are mechanisms for bad policing tactics to exist within certain neighborhoods. And these overarching themes kind of lead to experiences of trauma within the communities that are in turn over-policed. So here's the relevance of the study, kind of why I chose this topic. So Black individuals are 20% more apt to face mental health problems than the general population. Mental health issues like PTSD, anxiety, depression, they all exist at a higher prevalence within these communities. And then mental health is also highly stigmatized. These things do exist, but they're kind of ignored because people don't really want to talk about it in Black communities. And then Black males are 21 times more likely to be killed by a police officer than white males. So these kind of all just tie in the importance of the topic and kind of why we should link them together. And so we'll get right into it. So now I'll define the different kinds of trauma. So on the sheets that's been kind of going around, I don't know if everyone has one, but they should be somewhere around you guys, so you can follow along. So individual trauma kind of results from an event that is experienced directly by an individual. So that can be a physical or emotionally harmful event that kind of in turn affects their emotional or physical well-being. And then community trauma is a little bit different. It has to do with aspects of the community like people, place, and opportunity. So it's not necessarily like an individual event, but it kind of has to do with circumstances which affect them. So in turn, it does affect individuals as well. And this is just a model of community trauma. So you can see the three different parts that make up community trauma. So you have people, place, and opportunity again. Just as an example, we see deteriorated environments that make up the place section. So if you imagine like a community that has like a lot of broken down buildings with busted out windows, like just taking that in every day kind of does have a mental toll on people. So that's just an example of community trauma. So now I'll talk about a little bit about my method. So I conducted what's called a structured literature review. So I reviewed studies to develop some research questions and then kind of further refine them as I continue research. I identified some key studies and the methods used, some important findings, and then I used frameworks to help me conceptualize police behaviors as traumatic events. So now we'll get into my main points. So the first one is the formation of Black communities within society. So we'll talk about some historical examples that kind of led to trauma within Black communities. So they can be considered community trauma events. So they're not necessarily impacted onto an individual, but it's rather circumstances that did affect individuals. So we have racism and prejudice in general. We have the slavery time period and Jim Crow segregation. So all of these things can be considered just events that kind of took tolls on Black families, Black individuals, and kind of productivity and everything like that. So now we'll talk about specifically policies that kind of did create low-income Black communities. So the first one that I want to talk about is the National Housing Act of 1934. So one of the most important parts about this policy was that the Federal Housing Administration was created. And a big thing that this organization did was mortgages and loans for homes. So a practice that was initiated around this time was redlining. So redlining is the practice of giving places in like neighborhoods in a city different distinctions. So we have green distinctions for good and red distinctions for bad. And these distinctions were kind of given based on different things, but primarily race and income was a big factor for that. So it actually ended up that green was like white neighborhoods, wealthier areas, and then the red were more communities of color, immigrant communities that did not, they were pretty impoverished. And like I said, the redlining did affect home loan distribution. So people who lived in the red neighborhoods were not able to get loans to either move out of these inner city areas or better their homes that existed there. So that was just a couple things that policy did. And now I have a map. This is St. Louis. Back in the 1930s when the redlining existed here. So if you look in the middle of this gray box, that is Forest Park, just to kind of orient you guys. So the areas immediately surrounding it, you can see are green and blue, which those were the good neighborhoods. And then as we get further out towards the Mississippi River, you see more red and yellow. So these were the neighborhoods of color, the poor neighborhoods that, you know, were redlined. And then just to show you St. Louis currently, so you can see some parallels. This again is the Mississippi River, so we see a lot of green, which the green means like majority black neighborhood, and the blue means majority white neighborhood. So you see areas like West County, and then over here like North County, the inner city is very green. So it still shows like, you can see a lot of parallels and similarities between the redlining policies versus how St. Louis currently is made up today. So now we'll talk about another policy that really affected the creation of low-income black communities, and that is the war on drugs. The war on drugs took place in the 70s and the 80s, and this policy really racialized drug use. So we have two drugs, crack cocaine and powder cocaine, which are very similar. The main difference is price, very similar in the way that they affect people. So one thing is crack cocaine was heavily used by black people and powder cocaine was heavily used by white people. So with this disparity in usage, we also see a disparity in sentencing. So for 5 grams of crack, which this is about 5 grams of crack, you get 5 years minimum prison sentence. For 500 grams of cocaine, you get also 5 years. So you can just see the big difference in the way that these look. And when you think about, okay, you carry 5 grams, you get 5 years. If people happen to have more than that on them, then the sentences just accumulate. So we have black people being sentenced more often and for longer times for crack cocaine than white people. And you can just see like this is a lot and this is not. So it's just kind of crazy when you think about it. So this stat kind of shows that. So convictions for crack, 88.4% of black people were convicted versus only 4.5% of white people. So that again just shows like the very drastic difference in the sentencing. And both of those policies really led to criminalization of black communities that leads to policing, which we'll talk about in a bit. So, and this is just a graph of prison population. So as you can see, around the 70s and the 80s, we do see a large increase in the prison population. So that is around the same time that the war on drugs was happening. And this is not to say that the war on drugs was the only cause for this increase, but we can't deny the large impact that it did have on the increase in prison population. So now we'll talk about policing in these low-income black communities that were created. So when we think about policing behavior, we often think like, what is good behavior, what is bad behavior? One good thing that I found like in my research is community engagement. So that's like when police officers in the police departments are engaged with their communities, they know who their community members are, they know their stories, their backgrounds, they kind of get input from their community members, like what are the best practices that work for them. So when that occurs, when that's like strived towards in communities, that's a good thing. We should see more of that. On the other hand, we have bad practices. So the one thing is lack of standards for psychological evaluation. So police officers aren't required to, like when you first become a police officer, like usually you have a psych evaluation, but after that, it's not mandated. So, I mean, as we can all imagine, being a police officer is pretty stressful. Like you're in high stress situations every day, like you're the first responder to a lot of events. So that does take a mental toll. And when people aren't expected to get checked up and make sure that their mental health is okay, we can't be sure that they're doing their jobs in the best mental capacity. And then there's this thing called cop culture, which this is kind of based on like the hierarchy that exists within police departments, and it's kind of like a standard that police officers adhere to. So like for example, police officers who are new and they might report a certain incident, that can lead to them being shunned in their police department and be thought of as disloyal. So it's just kind of this code that police officers tend to adhere to. So with all this considered, we can kind of see how policing can lead to traumatic experiences for people of color. So now I'll define some driving factors of police brutality. These are also on the sheet that y'all have. And I'm sure a lot of you have heard at least one or maybe all of these terms, but I just wanted to put like a set definition in. So excessive use of force is using any force beyond what is necessary to control or apprehend a suspect. So that can be if you are trying to arrest somebody and you use a baton or a taser when you really don't have to. If they're already going to comply with you, you're just using that force for no reason. Implicit bias is kind of like an idea or like a stereotype that you have in your mind that kind of affects the actions and decisions that you make towards people. So an example of implicit bias could be you're walking down the sidewalk and you see a black male and you decide to like cross the street without even interacting with them. That's just based on some idea you have in your mind. And then lastly, racial profiling. So this is like targeting people of color without having evidence that they've done any criminal activity. So it's just like based on a perception that you think that they're suspicious and a threat. So that can be like seeing a Middle Eastern person at an airport and making them go through extra security. And this chart just shows how people perceive policing in these black neighborhoods. So this all has to do with procedural justice, and these are all percentages of residents who believe this thing that's listed to the left. So I'll just point out a couple. So as you can see, they're all less than 50%. So less than 50% either agree or strongly agree with all these statements. So for example, 30% of people believe that police officers treat people with dignity and respect. And only 26% of people believe that police officers make fair and impartial decisions in the cases that they deal with. So these are, ideas that people have about police officers in their communities. And if they don't think that they'll be treated fairly when they encounter a police officer, they're not going to want to encounter a police officer, and they'll be very stressed and anxious when they do. So that's just another way that trauma exists and manifests. So now we'll talk about the last main point, which is linking trauma to physical and mental health challenges. So cardiovascular disease is the leading cause of death for black males in their 40s. So cardiovascular disease is heavily linked to stress. So this can be straight by discrimination that people face in their neighborhoods or just living in areas that are highly policed. And then these three quotes are ones that I found from an article, and it kind of illustrates more of the mental toll that policing takes. So these are just kind of ideas, things that people have said based on their interactions with police. So like the first person thinks that they feel like police officers are troublemakers, they demonize people that they see on the streets, and they want to find a reason, like he feels like they always want to find a reason to make you look guilty. So this is just, if people are thinking that they're going to have these kind of interactions with police officers, like that's just another stressful thought always in the back of their mind. Okay, so to conclude, we talked a bit about trauma, individual versus community, and kind of how that plays out. Then we talked about some historical events and policies that really led to the creation of low-income black communities. And then, in turn, the over-policing that happens within those communities and leads to traumatic experiences. And kind of one thing I was thinking of, like to end this or to move it forward, I think that policy changes is what's really necessary. Things need to be more trauma-centered, more community-centered with like actual community members' best interests at heart. And then I have some food for thought, like things that I was thinking of as I was finishing up my research, and maybe things that I'd invite you all to think about as well. How can a dialogue conducive to trauma-centered healing be created in black communities? And are there any societal expectations of police officers that you think contribute to police violence? So you all can think about those. Maybe we can talk about that in the question and answer part. But yeah, I want to acknowledge some people, my family who's all here to support me today, my mentor, Dr. Gilbert, and everyone on the McNair staff and all the scholars as well. Thank you. So, does anyone have questions or? Yeah.
That was so good, Taylor.
Thank you.
I'm wondering if you have like suggestions for what citizens can do to make these policies move forward, like at least at the local level.
Yeah, I guess one thing could be I mean, besides like talking to policymakers, just maybe getting involved in organizations that do kind of work with people who've been impacted by police violence, or like Black Lives Matter movement, Forward Through Ferguson, kind of organizations like that that really push for policy changes when it comes to interactions with police. But you can always like call legislators. If you go to like city halls or anything, like with the mayor, tell her what you think is important, tell her what you think needs to change. So she hears that people actually care about this kind of stuff.
There's also a prosecutor's race happening right now with Bob McCullough and Wesley Bell. So looking into that will be good, and the election on August 7th. So not necessarily how to vote, but that's also something you can consider as well.
Good point.
I wanted to react to your second question.
Yeah.
I think one of the things that helps is when we realize that the relationship between police officers and the Black community has been on a continuum. Right, and so when you consider that there's been this sort of relationship that's always been there, then it's important to kind of go back and ask yourself, so where did that begin, right? So police officers were the original slave catchers, right? And during Jim Crow, right, as documented, right, these were the folks who basically set up folks for lynchings for the KKK. So you have to ask yourself, where in that continuum has there ever been stoppage between that kind of conflict?
Right.
And so I think therein lies the problem, right? Police have always been the people who were expected to keep the Black community in check. And so where's there been an interruption in that continuum? The answer is never, right? There's never been a point where we said, okay, so police officers no longer responsible for keeping the Black community in check. Right, we've just put window dressing on this relationship, but there's never been an interruption. Nobody's ever sort of called the whistle, and so that's why we still have it. There's always been conflict between police officers. It's basically gone from explicit to implicit.
This is less a question, more a comment of something you might find interesting. There's a podcast called Reveal, and it's investigative journalism connected with NPR. And there was they had an episode, and one of the things they were talking about bad policing. And one of the things they talked about was the psychological examinations, and how that sometimes they found racial bias within the examinations as well, because some of the thoughts are if you have more police who are of color, that helps with that, but if there's that bias in there, that can prevent them from becoming police officers. And so trying to look at that was, and they also did one on redlining, which was really interesting, and how it's still happening, so it was really interesting.
I don't have a question, but I do have a comment. First of all, excellent job. I actually was having a brief conversation with one of our DPS officers, Peter Gavin, and he saw your topic and really wanted to come. And he actually had reservations because he's in uniform. And so I wanted to mention that this is such a very thought-provoking topic, and it just impacts so many different areas. And we would have a university public safety officer who's also a police officer really be interested in your topic and wanting to come, but feeling like because he's in uniform, it might have some negative impact on anybody in the room. So I just had to bring that up.
That's interesting. I
Yeah.
don't care, but
So about 5 minutes, so any last minute thoughts, any questions?
What would you like to do next?
I think one thing that would be really interesting, I kind of wanted to do interviews with this section, but it's only 8 weeks, you have to get approval for like the IRB, stuff like that. So I think doing interviews to kind of talk to people about trauma, I mean, like doing the readings, like I got a good idea, but I think, like I haven't really thought of like solid questions, but I think I can think of some really like innovative things to ask people and kind of get a whole new perspective on like how trauma based from policing kind of affects people every day. So I think that would be a nice next step if I was to continue this research.
Just an extension on what the young man down there said. As a preschool teacher, I see like the community trauma in my students, because if you go to certain school districts, they think of police officers as saviors, the people that protect. But the students that I service in St. Louis Public Schools, they have a totally different outlook on what police officers are. and I work with babies that are 3 to 5. So they already have that fear and that angst about police officers. So because of what they see, not just what they hear,
Right.
but what they're actually seeing happen in their neighborhoods with their family members, their friends. So it's real. It's really a real issue with the trauma.
Thank you. Also, that was great. I have been watching a lot of the news about like ICE and like detention centers. How do you think that like the talk about ICE like goes in conversation with like your topic in policing, if it does at all?
Yeah, I think it definitely does. I mean, if we consider like police officers the ones to keep like Black communities in check, I think ICE does the same thing for like Latinx communities as well. And it's just like another level of like authority that people just like automatically fear because no experience with them has been like positive. And like when you think about what's happening at the border, like people, their families being like ripped apart, people are like just being detained, and it's terrible. But it's just like you see these like the bodies of like ICE and the bodies of police. It's just like they're kind of the ones inflicting that. So I don't know. I think there's definitely a parallel when you think about this too.
Anything else? I don't know if you've done this or maybe you could consider it, but looking at like undocumented Black Americans, that could also be something because they're definitely like underrepresented. And
Yeah.
like, shuffled under.
And that's interesting because there was actually one article I saw that they specifically mentioned that they don't just consider Black people as Americans, they also do consider like non-American Black people because they do face, like it's a different thing that they face, but they also face like the racism stemming from their Black skin. But then there's also the side of them being like non-American as well. So that was brought up in one of the articles I found. Yeah.
Just as a thought, there is also a organization within the St. Louis Police Department that also looks at this, and it may be great to engage actual police officers.
Yeah, when I was thinking about doing the interviews, I actually would have interviewed police officers and then members of a community oversight board that exists, and then actual community members. So. Okay.
I'm just curious, do police officers have just some cue of that there's overwhelming evidence of what's going on?
I don't know.
Or
I feel like
acceptance?
I feel like there kind of has to be, but you mean like do police officers realize, like wonder about this?
Yeah,
like,
do they know? Is there conversation?
Yeah, I would think
guess
there has
you're
to be,
making- yeah,
but
yeah.
They do.
yeah, especially like after the big cases like the Stackley and Michael Brown, everything like that. Like I would think they have to kind of talk about these things, but yeah, I guess that would be interesting to get like the perspective of a police officer, like maybe one who doesn't agree with what's happening and one that is kind of complicit in what's happening. So that could be interesting to see. Okay, I think we're out of time, but thank you everyone so much.